Hello, thank you for joining the COVID school safety overview. My name is Dr. David Farkas. I'm the Assistant Superintendent at San Ysidro School District. The purpose of this overview is to share all the great things that are going on in our district when it comes to school safety and also updates that have presented themselves over the course of our first 5 weeks of the school year. We've updated our COVID safety prevention plan. It's located on our San Ysidro School District website. This has been updated prior to the beginning of the school year, and it coincides with the California Department of Public Health guidelines as they've changed over the course of the last few months. There's also on our website the symptoms list. A little complicated because symptoms of COVID often mirror the same symptoms of a cold that's been happening over the course of the summer. But the symptoms list is also available to assist families in screening their students and also employees before they leave the home. And then finally, the decision tree based on our county health department. Our decision tree helps inform our schools and our families for best case scenarios on various, and most importantly, quarantine of a student that maybe was exposed or an adult that was exposed to a positive case. Our primary COVID school safety protocols have been, like I said earlier, updated based on our California Department of Public Health and any changes that have happened over the course of the summer and the early part of our school year. Currently, we have temperature screenings in place at all of our schools. We also have health screenings, self-screenings for our families, again, using symptoms and employees before we go to work or school, and encourage anyone with symptoms to please stay home until they know it was in COVID related. And then also face masks are required indoors. So I want to praise everyone for our district has done a fantastic job of ensuring that we are communicating with each other and ensuring that even our younger children in our kindergarten and TK classrooms in first grade are also keeping those masks above the nose. And that's when we all wear them indoors when students are present at school. Hand washing and sanitization of our hands. We have plenty of hand sanitizer and hand washing soap. We encourage that, especially after recess and anytime they're entering the classroom. Plexiglass has been established, even though that's not part of the California Department of Public Health. We had all of it installed in the spring, and when our students came back in the fall, we ensured it was still up. Staff has the option if they would like to keep the plexiglass at their workstations. COVID testing, although there's still areas of improvement we'll speak of in a few slides. We're very proud of our COVID testing and also of our families and staff that often COVID test just to ensure safety. Contact tracing with the county health department is utilized anytime we have a positive case to make sure that we have all the resources working together. Vaccination clinics we'll speak of in a few slides. We understand the importance of vaccination and encourage vaccination, including at our own vaccination events. Visitor limitations are still in place based on our area's case rates of COVID. We are limiting visitors to as needed basis, which isn't very often at this point. Teachers have done a fantastic job with seating charts, and this helps us with contact tracing anyone that potentially was around a positive case. Grade level cohorts, we've extended our recess schedules so that there's more recess time scheduled, and that reduces some of our crowded playgrounds. So I want to praise the schools and the administration for organizing new recess schedules. And lunch as well. Not an easy thing to do, but we are eating lunch outside at our schools. And then finally, the University of California at San Diego has a research pilot program. We were using that at a few sites last spring. We're also interested in continuing that work into the fall. Vaccination right now in our country is the #1 mitigation strategy to reduce our COVID rates. Last spring, our district was one of the very first to work with VIVA to offer for our employees vaccinations, and most employees interested in vaccinations were fully vaccinated by April, and we're very proud of the response and the partnership with VIVA. Majority of our San Ysidro employees are vaccinated, and we're very proud again of everyone moving quickly on that before we opened our schools. We're currently waiting on clinic number 6. So we've had 5 so far, and we'll have another one in September at our San Ysidro School District middle school sites, where we're getting our 12 and older and also our employees and families as well in the community to be fully vaccinated. And there's potentially optimism for our younger groups that could be eligible to vaccinate in early 2022. COVID symptoms, like I said, on the website are available. And there's always, with symptoms, especially lately, there's been opportunities for everyone to be very cautious. And oftentimes these are cold symptoms or allergy symptoms. And we just want to praise everyone for working together, because it is frustrating if a student has a sniffle or a cough that's not related to COVID. But obviously, as a community, we take it very seriously. And at school, we want to make sure students that aren't feeling 100% are being recommended to test. And I know that's not easy for families. So thank you for the teamwork and the community working together to monitor our students and being patient with each other. It's definitely a challenging time. And then you add in the colds and the allergies, and it makes it complicated. So thank you very much. Most importantly, if somebody has symptoms that are unusual and not related to an allergy, we ask that they stay home and receive work from their teacher. The health department quarantine decision tree, it's very complicated. It has 4 pages to it, and we've become pretty good at understanding it and communicating it with our site administrators. Hopefully soon our staff will better understand it. Now that we have our classes up and running, teachers were focused on having a good start under these circumstances, did a great job. Now the idea is to make sure people understand a little bit more of the decision tree. Positive case, as much as we don't like to hear that word or phrase, positive case, it's very simple on how we handle a positive case. The positive case, whether they're vaccinated or unvaccinated, always has to stay home and isolate from everyone for 10 days. And that's beginning either at the symptom time or a test collection time, whatever one is first. And that 10-day period, on day 11, they return to work or school. So that's very easy to understand. The quarantine side of the decision tree is very complicated because there's different options and different scenarios. So what we do is we handle them case by case, and again, follow the decision tree and communicate and ask for everyone's communication and honesty to get to the bottom of each case. Close contact is often a word we use for quarantine and for these cases, and that is somebody that's within 6 feet for more than 15 minutes throughout the 24-hour period. So that would be an example of why our seating chart matters in school. If somebody's close to a positive, we know they sat close to that person. It's not perfect, but with communication and all of our resources together, we can identify our close contacts and then recommend that they test on day 5 after contact with a positive case to ensure that they do not contract the virus. Vaccinated people that are in close contact do not need to quarantine. Another reason why vaccination is a real benefit to our schools and to our community. They do not need to quarantine unless they have symptoms. Unvaccinated individuals, even if they were wearing masks, as students, they can remain at school and test every 3 days with permission from parents. They can quarantine, which is staying home, and test on day 6 get a negative result and return on day 8 if they're negative. And the other choice would be to just stay home for the 10-day period and return on day 11. So there's different options for mask to mask student contact with the positive. For adults, even if you're wearing a mask and you're at the work site, there's no options. The adults always quarantine for 10 days and monitor their symptoms and then return. Again, that's for unvaccinated. If an adult is vaccinated, they do not have to quarantine unless they develop symptoms. They can continue to work. And then with no mask, usually, which was most of our cases that are coming from outside a home or a different environment, those are different and they have to quarantine regardless of masks or not masks. They need to make sure that they are quarantining for 14 days. And it further complicates itself when we say after last contact with a positive individual. So if that individual is living with you and they're positive and you can't completely isolate, which is difficult in our family households, then the quarantine period doesn't even begin for a person that's still negative until that positive individual runs through the whole 10 days. And then the quarantine begins for 14 more days. So you can see how that could impact work and school. And another good reason why vaccination takes a lot of those days away for that situation. Contact tracing and confidential close contacts. Our district does everything we can to communicate all of our cases. That's led by me on my letter that goes out. Still keeping confidential the name of the person. We're also working with a service called Maxim Health and looking for extra assistance with contact tracing through a contract. A close contact, again, is somebody that is close to somebody somebody positive for 6 feet for more than 15 minutes throughout the 24-hour period. And again, we have the modified quarantine option with our close contacts. A special thank you goes out to everyone, not only for the patients, but the communication and teamwork. Our site principals have learned a lot in these last couple of weeks and have done a fantastic job. Our site administrators have done a fantastic job of communicating with me and then with our staffs and our families. Teachers have done a great job of organizing seating charts and communicating with admin when there is a positive case. And then our health clerks are probably one of the hardest working groups in all of our district. They've been fantastic in learning and working together with families and the site admin and teachers. And then obviously we need other staff to really help as well when it comes to all the different things we do after a close contact, after a positive case. So our modified quarantine, again, we can remain in school. We also know that there's a short-term independent study contract that we can provide for our families and our students that could go from 3 to 10 days. And that's based on how long the student's going to be out so that their attendance isn't marked as absent as long as they complete the work. And their teachers have done a great job of supporting either with paper packet or even work that they've been working on with the Google Classroom. So a real team effort for keeping our students engaged while they're unfortunately at home for quarantine purposes. And then our district communication, we send out our letter when we know there's a positive with enough information so that people are aware. We have a COVID dashboard set up that tracks the number of our cases on our website. The schools can also notify close contacts and share what the options are for that scenario. And then we work with the county health department to ensure they understand the names and possible close contacts for any more advice and follow through. And then after every single positive case, our wonderful MOTF team goes out to those areas and does a great job of spraying very specific sanitization products to ensure that the air is sanitized and cleaned for the next day. And our COVID testing data overview, from the first day of school until today, 8/26, we've had 52 cases. That represents about a little less than 1% of our total student and staff population in our district. About 50 of our contact trace to community transmission, again, from home and other places that have been identified. And then 2 have been possibly transmitted from somewhere inside the school. Fortunately, to only 1 other person. It's unverified, but likely that, or possible that it's happened. And that's, again, the importance of those masks and everything that goes with our safety protocol to avoid any outbreaks or further transmission. So kudos to everyone for a nice start to a very challenging school year. We've tested over 500 with our special 15-minute COVID testing kits at our district, and only 1 has come back positive. Our new state health order, the expectation is to implement our new health order before October 15th. And that's basically saying if you're vaccinated, you provide proof to the HR department, and that's all that's needed. And that's done before we get finished with our month here and into September. And then we will also be, anyone that's not proving vaccinated will be provided with weekly testing at our district area here. So there'll be organized testing for those unvaccinated to ensure that they are safe and negative. And then our COVID testing options. We are enhancing our already strong testing options to make them even stronger. One way of doing that is to get more testing to our school sites. And we're working on weekly testing for our school sites that should be starting very soon. And again, will be based on parent consent, but I highly recommend this very easy system where it's basically just a Q-tip at the bottom of the nose for the students and staff. That'll be conducted at all of our schools. The rapid antigen Binax kits that we use, we still use them, but we use them focused on, most importantly, close contact situations so that we can offer that quickly with our new testing teams that can be deployed to those sites and get permission from the parents. And that way we can do that often with our kits, and the results come back in 20 minutes. And then you can see that we have the concentric test. That's the weekly testing that we are getting very close to implementing this is sponsored by the California Department of Public Health. And that concludes the presentation of how far we've gone and what we have in place. I know there's probably specific questions that are out there based on different scenarios, or maybe there's even something that you need more information on. If our website or this presentation hasn't provided it, I encourage you to email me, and you can see the email on the screen, and I will get back to you in a short while and ensure that it's either a phone call or a good answer for you so you can have more information. Thank you for listening to the presentation, and stay safe, wear those masks.